Thank you very much for joining us at our meeting today and for participating with us online. For those of you able to join us here in person today, printed copies of the agenda and presentation slides are available at the back of the room. For those of you online, the packet can be downloaded from the National eHealth Collaborative website, www.nationalehealth.org, and it's available now. As always, we welcome your questions and comments via the webinar or email at info@nationalehealth.org, and our staff is also monitoring Twitter, #NeHC. We ask that everyone participating online submit your questions and comments for today's stakeholder forum in writing, but we will also have a public comment period at the end of the session in which I will individually unmute phone lines for you to share any comments with us. If you'd like to speak, please make sure you are logged into the webinar and use the webinar-generated attendee ID when you call in on the phone. We have a great stakeholder forum scheduled today, so let's get started. I'd like to call this session of the National eHealth Collaborative Board of Directors meeting to order. I'd like to first start by asking for any conflict of interest disclosures from the Board of Directors. Hearing none, I'd like to introduce the stakeholder forum, which was coordinated today by Michael Lardiere on our board. This is about the health center controlled networks, helping communities reach meaningful use. With the recent release of the meaningful use rules, strategies for reaching those goals have been literally on everyone's mind. Today, we'd like to bring to your attention a resource that you might not yet be aware of, the health center controlled networks. These networks were originally designed to connect health centers, but are actually available to all providers and could very well be a good option for some practices that are looking for ways to meet the health information exchange related criteria of the Meaningful Use Incentive Program. We're very pleased to have Michael Lardiere, the Director of Health Information Technology for the National Association of Community Health Centers, and a consumer representative on the NEHC board, here to help us learn more about this untapped and valuable resource. Mike, would you like to get started by introducing our guests?
Yes, thank you very much, Laura. And I'm very happy to moderate this session today. And we have three health center controlled networks that are also regional extension center grantees available to speak with us today. Paul Matthews, who's from Ochin in Oregon. Walt Culberson, who's from CHC Alliance in the Tampa area of Florida, and Michelle Russell from Health Center Network in the Miami area of Florida. So each of these has attained Regional Extension Center awardee status. So that does make a difference, because in the past, health center controlled networks were seen as only being available to federally qualified health centers, but they extend much further than that, and hopefully we'll discuss that more today. So what is a health center controlled network? Health center controlled networks, as identified in the past, they are a collaborative partnership between between and among actually federally qualified health centers, in that it needed to be a collaborative effort of 3 or more federally qualified health centers. They needed to do more than just come together to receive HRSA funds. They're funded by HRSA. So it means they really had to have relationships and understanding to do more than just receive a grant. They needed to do things like quality improvement, perform other core functions that would not be duplicated across the other FQHCs that are part of the network. So they're both business and clinical functions that they would perform. And so we asked the question, why would you use a network of organizations? Well, the collaboration of health centers and other safety net providers. They can also bring in other safety net providers, and that collaborative work leads to economies of scale and cost. And there's also efficiencies due to the volume of bringing organizations together. It's like any other business. If you have 10 different sites, you're not going to set up all your redundancy and purchase everything that you need at each site. You're going to bring services in together to improve those economies of scale. There's also enhanced efficiencies in business and some of the core clinical processes. There's higher performance and value in what they do because they can share expertise among the staff and the collaborators. So 2 minds are better than 1, and 10 minds are better than 2. So it works when everybody works together. So what has happened over the years? Here I'm going to talk a little bit about some of the funds that have been used, that have been provided to health center controlled networks by HRSA. And this is an overview of grants from 2007 to present. Actually, present was in this slide is back at the beginning of the year. And these slides, some of these slides are courtesy of Susan Lumsden from HRSA, the Bureau of Primary Health Care, who provided these slides at the NAC conference that we did together. So the funds have been used for EHR implementation, but also for EHR system training, hardware, software, conversion of current processes to new processes in the EHRs, network infrastructure. Those are some of the examples. So in 2007, there were 137 health centers that were participating in the 2007 period grants that started in 2007 and in 2010. And of those, 108 health centers are live within EHR. And that's as of the beginning of the year, so we have a few more now. So 79% of those health centers are actually live. In the 2008 projects, 53 health centers participated, and 31 of those health centers became live in a short period of time. And in 2009, 62 health centers are participating, and we have 2 health centers, again, that's in the beginning of the year, that are live. So you can see these health centers come up pretty quickly when they work with a health center controlled network. And the numbers are growing and getting better all the time. So what is some of the characteristics of a health center controlled networks and their EHRs? Well, 99% of them are using CCHIT certified EHRs. I think there's one network that has a homegrown EHR, so that was not CCHIT certified yet. 97% of them have practice management systems, and those that don't, we're implementing them. 74% have electronic eligibility screening. 81% have clinical decision support. 67% are using a disease registry, and 55% at that time are using e-prescribing, and 52% already have CPOE. So many of the requirements that we're looking for in meaningful use are being met by the health centers. You can see that there is still work to do, but it is moving forward fairly quickly. So some of the activities of the health center controlled networks also help to move towards the patient-centered medical home and being certified for that. In New Hampshire, the Community Health Access Network up in New Hampshire is the health center controlled network up there. The largest member received a level 3 NCQA, patient-centered medical home certification, and that was in large part due to working with the health center controlled network. Otherwise, they would not have been able to do it by themselves. In New York, the EHR-based reports that were provided by the network assisted the Institute for Family Health Care in becoming a level 3 patient-centered medical home. And again, that's NCQA certified medical home. In Massachusetts, the grantee implemented an e-referral system as part of their health information exchange project to improve care coordination. And then they monitored some specific metrics. We looked at lag days between a community health center referral request and when the appointment was scheduled. And before the network was involved with the health information exchange and focusing on this area, it took 56 days. After the health center controlled network was involved and participated in and set up the health information exchange, that came down to 2.7 days. They also looked at lag days between when a patient was seen by a specialist and when the specialist report was sent to the community health center. Before they implemented this process, it took 32.9 days, and afterwards it took 9.4 days. So those are significant changes in coordination of care activities. They also work with telehealth, and in our Finger Lakes community and Migrant Health uses telehealth for specialty care. They do oral health, ENT, and dermatology and other services using telehealth services. They use it for distance learning and training for providers. And they also use it for some of the enabling services that health centers do on a regular basis, such as interpreters, outreach, and using the telehealth services. Those were all set up through the health center controlled network so that the health centers that are part of the network could utilize those services. It would be hard for a health center on its own to set up that same process. And if you had, I think there's 5 or 6 health centers up in that area that are connected, for each one to set up this process on their own would be an extra expense that is really not necessary. So how are health center controlled networks evolving? This slide comes from a study that Manette did for the health center controlled networks. And they're moving from just a collaborative effort, which are the little circles on the left, just self-contained effort, to begin to share information among health center controlled networks. That's beginning to happen in some places. And where we're moving towards is really for health center controlled networks to begin to be able to share information throughout the whole system. So we're looking to share information with the state-designated entities, with hospitals, with regional extension centers. The 3 groups talking today are regional extension centers. However, we really would encourage regional extension centers across the country to integrate with health center controlled networks. We have about 80 health center controlled networks across the country. Some regional extension centers are actively involved with the health center controlled networks, some aren't. But as you'll hear a little later, these are great resources for the regional extension centers to utilize. So where are we going? The ultimate requirement of EHRs and health information technology is to realize the EHR's benefit is the organizational vision and infrastructure to utilize the data to introduce improvements in the clinical process. So we're moving from readiness. What the health center controlled networks help health centers, other providers do, is move from readiness to adoption to meaningful use to better quality care. So then there's always the question of how we get there. Well, you can get there using a health center controlled network. All providers now can actually use a health center controlled network. Different networks are in different stages of development, and some are more ready to move to work with other providers than some. But as you can see, there are health center networks located all across the country. You don't need to be geographically close to a health center controlled network. We have networks who, and you'll see today, who provide services in states far away. Florida is providing services in Utah and New Mexico, and that's just one example. So how do you find a health center controlled network? Well, on the NAC website, we have a link where you can download the list of all the health center controlled networks with the contact information. There's also a HRSA website, and this is the a link to the HRSA website. We link to that on the NAC website as well, where you can actually find a health center controlled network. You can find them by state. You can find them by the vendor that they use for the EHR. There's a couple of different search functions. So today, what I'd like to do is introduce 3 folks who will speak about the health center controlled networks, what they do, the different models that they use. So first we'll introduce Paul Matthews, who's the CTO of OCHIN, which is located in Oregon. We'll then have Walt Culbertson speak, and he's the Regional Extension Center Program Director from Community Health Centers Alliance in Florida. And then we'll move on to Michelle Russell, who's the Senior Director for Business Development of the Health Choice Network.